UK Healthcare Community Connection is sponsored by UK Healthcare.
Welcome back. We are joined by Dr. Mansi Shah, and she's here to discuss the robotic surgical options at UK Markey Cancer Center.
Welcome to our studio.
Thank you for having me.
So this morning we're talking about lung cancer, and we're curious what kind of treatments with robots can be used with this type of disease, as well as other minimally. This is why I'm not the doctor. Invasive surgery.
No, so I think one of the things that I wanted people to know is here at UK we offer three main types of robotic options within the field of thoracic surgery. So one is for lung nodule detection. There's a robotic bronchoscopy that helps us to biopsy very small nodules. And then there's two robotic techniques to actually remove the lung cancer. One uses multiple cuts, and then the latest and most advanced technology is actually just a single cut where we can put a camera and long instruments and do a lot of work on the inside. That's one of the things that we offer that is not offered at many places around the United States.
Well, obviously in the past there's been traditional surgical methods, but now you have this. How has it made a doctor's life just a little bit easier? I hate to use the word easy when it's something like this, but I imagine it's helped tremendously.
It is. The visualization is fantastic. The newest technology allows 3D visualization of what we're working with, but the biggest thing is for patients, it's a game changer. The traditional surgery was a big incision, long recovery, long time in the hospital, weeks to months before you could get back to living your life. Now, especially with one small 4-centimeter incision, it's a couple days in the hospital, 1 or 2 maybe, back to your life in a few weeks. And that means less pain for patients, less pain medicine for patients, and getting back to living their life faster, which is really the goal of all of this.
I mean, this sounds fantastic. For someone who qualifies for this type of surgery, is there any other question that they should ask ahead of time?
Really, the main question they should ask is, can I speak to a surgeon? It's really hard to know whether or not you're a surgical candidate until you talk to a surgeon and can be evaluated.
How common is this kind of treatment across the country?
For single port robotic thoracic surgery, it's not very common. UK is one of the few centers across the United States that's offering this type of specialized robotic technique. And I'm proud to be at Markey and being able to offer this.
What kind of impact have you noticed having this available that it's been for Kentucky?
I think it's great for the patients of Kentucky. It allows us to treat a wider range of patients, from young to old, from healthy to not so healthy, from non-smokers to folks that have smoked for 50, 60 years. And so that's why I encourage people to ask about it, get screened for lung cancer, because this technology allows us to help people that we weren't able to help before.
Well, it's great having you in studio, Dr. Shah. I know I learned a lot from it, and I'm sure our viewers out there did as well. Another UK Healthcare Community Connection.